Attention Deficit Hyperactive Disorder, otherwise known as ADHD, is when someone has difficulty focusing, paying attention, and is hyperactive. In 1902, a man named George Still was the first to group children who did not behave and had no other disease and were of normal intelligence. The first time there was an official diagnosis for this behavior was in 1936. The word hyperactivity was added in 1968. In 1972, the condition was called DSM, minimal brain dysfunction. The DSM manual is a manual that doctors use to diagnose mental disorders. In 1998, it was called ADHD, which is the name we use today. There are three kinds of ADHD: hyperactive impulse, inattentiveness, and hyperactive and inattentiveness. The causes of ADHD are unknown, but there have been studies on twins that genes may play a role in this disorder. Other factors may contribute to ADHD include environmental factors like exposure to smoke, alcohol, or lead during pregnancy or early childhood. Immunization, preservatives, or food additives like artificial colors and preservatives are suspected to being a factor. Sugar was once thought to cause hyperactivity in children, but has been ruled out of scientific studies. Treatments for ADHD include medication, various types of psychotherapy, education or training, or the combination of treatments. The most common medication treatment is the use of stimulants, which have calming effects, reduce hyperactivity, impulsivity, and improves the ability to focus. Psychotherapy includes the behavioral therapy that teach children to monitor their own behavior and social skills, including self-control. Medication is only part of the solution. Children with ADHD benefit from having a regular schedule, organized locations for items, and help with organization of homework and notebooks. Clear and consistent rules make it easier for the children to understand correct behavior. Giving praise and rewards when they exhibit good behavior is also helpful. This is the percent of children aged 14 to 17 years with a reported diagnosis of ADHD currently taking medication for ADHD by state. The darker shaded states represent greater than 75%. There are some famous people who had ADHD and turned out very successful. For example, swimmer Michael Phelps, actor Will Smith, and singer Justin Timberlake had ADHD. We know more about the disease than we did in 1902. However, there is still research needed so we can discover new treatments for ADHD.